Okay, so I'm going to take you through probably half an hour worth of content to describe some use cases around Qlik in healthcare, predominantly from Australia and New Zealand. What we're seeing here, we've got a very large footprint, but I'll touch on some other examples from overseas as well that are relevant to some of the topics of interest to you guys. So just to set the scene in terms of the discussion today, we'll touch on why Qlik. I'll take you through some of the solutions, then I'll flag some helpful resources for you towards the end. And then if we've got time, I'll do a quick demo of an application and then open the floor to any questions you may have around anything I presented or just the industry in general. So I know you guys are all customers of Qlik, or the majority are customers of Qlik, but just to recap in that we've got over 3,000 healthcare customers globally that are using us to improve patient outcomes and experience, reduce costs, and optimize their processes. So we use across the globe as well. It's not isolated to a particular continent or a region. A lot of organizations globally are seeing extreme value in Qlik in terms of what we're able to deliver for our clients, the healthcare clients. And traditionally, we see, unlike some of the other solutions or competitors out in the market, where they're very point solutions. So there might be, as an example, like a Power BI deployment in HR or something in pharmacy or something in operating theaters. Whereas where we find Qlik, it's really about the enterprise or the platform-based analytics solutions across all these different domains, whether you categorize them as operational, financial, or clinical analytic tools. But there are solutions across all these different domains, and we've got lots of examples where we can talk to and demonstrate some of that capability. So we use this, I've used this slide really just to help paint the picture, because there are many different drivers in healthcare, and there's a solution to match. I say this, and I used to be a customer of Qlik before I joined their team. But we talk about, I remember the old industry director that used to engage me and support me in my journey when I was a customer, used to say to me, you're not limited by the technology, you're limited by your imagination. So depending on where your priorities are and what your focus is, if you want to look at your major focus or priority for your health services to improve operational excellence, you might want to then look at focus on developing applications around your patient experience or service operations or utilization. If you're looking at reducing costs to become more efficient, stretching the dollar further, because everyone's got a finite budget, there's higher and a cost of care, and the age of living is also increasing, so there's more demand on the health system. You might want to look after your workforce management, so you can look at reducing the number of overtime used or your premium staff usage, etc., or look at program management to see how you can find clinical performance improvements in redesigning some practices. So this just sort of helps set the scene around where you might want to focus on, depending on your drivers, your priorities across your health service. Because like I said, there are so many solutions across healthcare, but typically across every geography, we find these are generally our top healthcare solutions. The command center, we're seeing a lot of interest in this space, being connecting all the different data points from the ambulance into emergency, into the ancillary services, so pathology and imaging, into what beds are available in the hospital, to ensure the patient flow is seamless and efficient as possible, to make sure that there's always beds available and you're able to meet demand. Emergency department obviously goes without saying, being a core piece of the front door to any health service. Obviously monitoring your labor and productivity from a finance and governance perspective, patient costing, understanding your costs across your health service, see how we can drive down or eliminate unwarranted clinical variation that are impacting on cost and stretching your dollar as far as we can to treat more patients. Over the last year or so, we've seen, particularly around the COVID pandemic, inventory and supply chain and procurement has been a major factor for healthcare, whether it's buying or ensuring you have enough personal protective equipment or other inventory available is key to understand what your supply chain looks like. Chief executive dashboard, giving the whole holistic view of all of healthcare operations, from quality and safety to workforce to patient flow or patient activity and quality and finance as well. And there's some on the clinical side where we're seeing a lot more use and uptake from a Qlik analytics perspective. Some really great and fantastic applications around, helping our doctors and our allied health staff and our nurse staff delve into the data to see how they can understand clinical variation better and how they can, again, eliminate the unwarranted parts of that variation. Look at some predictive modeling, whether it's readmissions or who's presenting to your hospital, the predicting an length of stay, and then obviously your patient cohort discovery, understanding the best ways to see how you can treat your patients with different programs. And these aren't, as I said, you're not limited to these. This is just another snapshot of some other example applications, all bringing in different data sources, ultimately, most of the time, multiple data sources as well. That's the beauty of Qlik, being able to, as you know, being able to merge different data sets together to see the whole story is really key to some of the success that we've had in this healthcare industry. So again, some more examples, then touching on that digital twin scenario that Maris highlighted earlier, around some more modern uses of the technology and analytics to help drive more understanding and data literacy from our clinicians, and using data to drive best practice. So just on the solution showcase, and Maris explained to me that there's a need, or I guess, or an interest from Latvia and surrounding countries around understanding, system-wide analytics use cases. So establishing a set number of KPIs, or understanding what KPIs to monitor from a healthcare delivery perspective, to get an understanding or an appreciation for how the health system is operating across the country, making sure that it is providing the services to the community and the citizens it needs to, making sure that you're providing good value for care, that access is equitable, and that the staff are satisfied and the outcomes of those care programs are adequate as well. So I'm going to talk you through a couple of approaches that we've undertaken here in Australia. And what we do is the federal system funds the states to then drive and deliver healthcare operations or frontline healthcare services for our citizens. And each state then undertakes a service agreement, a contract, if you like, with each different jurisdiction, each town or jurisdiction that's responsible for providing or delivering the healthcare. And these agreements, delve into the requirements from the health system that they agree to provide on behalf of the state. So things around their financial performance, what activity targets they have, what programs and community programs they're going to run, and then it also stipulates the key performance indicators and the service measures that they're going to monitor to ensure that those services are being delivered in the most efficient and effective way. So as point 1.2 says, it's the development of these service agreement between the chief executives and the hospitals assists this process by formally assigning accountability for the high-level outcomes and targets to be met during the period. So they all agree, they negotiate, and they discuss what these targets are going to be, what these outcomes they want to achieve, what KPIs are, and then they all know that it's very transparent, and people are then accountable across the entire system for achieving those results. And these documents, you can see I've got a link down here, and I'll provide this deck to Maris to provide to you guys after the session. But you can all just click on that link, or just type in service agreements, New South Wales Health, service agreements, Queensland Health, service agreements, South Australia Health, and you'll see very similar documents. The health services have to publish their documents, so they have to make them available to the public. As we said, it's all about being transparent, and so people understand what the responsibilities are and the requirements are, and they're held accountable for these. So you can always look through these documents to understand how they're established. But as I said, within these documents is a whole list of different key performance indicators and service measures that the system needs to provide. So not only is it about collecting the right data and ensuring that data quality as a high standard, but it's then also about setting the parameters for what is what the targets are, and then what they deem is not performing, underperforming, or performing across those metrics. So they're the ones on the left-hand side of the screen, as I was just describing, some key performance indicators around safety and quality, service access, and patient flow. But on the right-hand side, you'll see that there's no targets specifically around these measures. So these are what they call service measures. So these may have been KPIs a few years ago, but because the system got so good at reporting them and treating these patients or addressing this particular need, they then become service measures, which just means that they are still monitored by the health system or the jurisdiction, the administration, but it's not necessarily a key performance indicator. It's something that we need to know is still being delivered and it's delivered in the right way. But if we identify that through the data that's collected and reported on, that the performance becomes drops or deteriorates, then that then may move into as a key performance indicator for that particular health service. So again, it's just ways to monitor and encourage people around what their targets are and what outcomes the health system is looking to deliver, and then being able to formally track these on a monthly, weekly, daily basis across the entire health system. So as an example, as one dashboard, this is the New South Wales Health dashboard. So they have just an overview of this is just a snapshot of 6 key performance indicators around patient access and flow. So you can see it's related to emergency department presentation. So here, the transfer of care from an ambulance to the hospital, the emergency treatment performance for all targets, for all patients, surgery access, total presentations, etc., etc. So it gives you a helicopter view, if you like, these main health indicators. It's a statewide view, and then as you want to click into it or get more detail, you can interactive, so you can jump into further analysis. So as I make a selection, then you can look through and delve into the weekly performance. We have some graphs here that allow the health services to track by individual services. So the different health services, who's performing, they're all color coded to see who's performing, underperforming. You can look at the transfer of care, the target for the facilities, how many ambulances arrives under 30 minutes. You got some trend lines, etc., etc. So you can start making different decisions around here and understanding how your facility is performing by determining which dimension or which measure you want to select. So if I select through here by the choose the measure, you've got all the different KPIs and service measures. You can choose the dimension as to whether you want to look at an individual facility or a local health district, which is a group of hospitals that you want to select. As you make your selections, you delve into it again to look at whether you want to do it via peer groups. So the same type of hospitals, not to comparing the metro sites to the metro sites rather than comparing a metro site to a regional or rural location. You get these just system-wide views across performance in a nice, simple, easy way to be able to comprehend and use for monitoring activity and performance. So I'll just quickly flag through these just to get through just an example. And again, as I said, I'll share this deck with you afterwards, so you'll get access to these to look into it in a bit more detail as you need. But this allows you to analyze and dependencies between 2 different measures to see how they might be correlating or impacting on certain performance. So there's really smart ways that you can look at different KPIs to make sure that you're tracking okay. This just allows you the correlation between 2 measures across different facilities and peer groups. And this is I'm just going to play a quick video here of the Queensland Health example, and they call their report the System Performance Reporting group. So they look at this dashboard, and what they've done is they've gone for a more interactive visual element. So this allows you to view data across the entire system via different KPIs on this, what they call as an ASTA chart. So each KPI is listed. You've got the target line being the dotted line, green being performance above target, orange reaching target, or red is below target. As you see on the left-hand side of the screen, you can then select the map to choose the different hospital and health services. And you can click on multiple of ones as well to see and compare how different facilities are performing against those same KPIs and performance indicators. So at any one time, Minister for Healthcare, senior clinician, a chief executive can always just click through and get a really clear snapshot of facilities performance against these key performance indicators. So it just allows much more interactivity around that space. And as you then select a particular KPI, you delves into further detail. So you can able to get into nuts and bolts of the data as well, to see how you might be able to understand performance at an individual level as well. So I'll just let this video play out quickly. So you see here now how it dives into one of the KPIs and what that shows the user. So everything, as you know, with Qlik is completely interactive. So as they make a selection, you get that information really quickly, and everything updates at a click of a button. So that's the idea behind the application, the view across the health system from a system-wide perspective. So here in Australia, they nominate and they agree through negotiation around what targets they need to achieve for the year. And that's activity targets across emergency department presentations, outpatient clinics, inpatient admissions, mental health admissions, rehabilitation admissions, but also the KPIs, the key performance indicators, and the service measures that are going to drive, and some of the strategic priorities are going to drive the healthcare operations and delivery for that year. And it's a way to then monitor that on a really intuitive and very transparent basis. So there's nothing hidden, everything is out in the open, and encourage people to use the data to drive new change and discussion and process improvement. So that was from a system perspective. So now I'm going to focus on some frontline analytical use cases in healthcare that might inspire you guys to some of your own individual work, or around some clinical needs that you have in Latvia that you're curious to see how other organizations have approached the same challenge. So Marish described as well that antimicrobial stewardship, or the overprescribing of antibiotics, is a concern as well, or a challenging area that you're looking to address. So this is just the next few slides, are just to showcase some success that we've had, or our customers have had, using Qlik to address this clinical need. So as you know, antimicrobial resistance or antibiotic resistance, it occurs when germs no longer respond to the antibiotics designed to kill them, and that means that their germs continue to grow. And it's really, they develop because healthcare systems and clinicians have overprescribed. They've almost given too much antibiotics when it's not necessarily needed, so that the body develops its own resistance to that, and they become really difficult to treat. And in some cases, treatment is impossible, and the outcome for the patient is catastrophic. So what the system, like the CDC in the US, estimates that in US hospitals and emergency departments prescribe around 47 million antibiotic courses annually for infections that do not require antibiotics. So colds, the flu, tonsillitis, things like that, where there could be better and more appropriate treatment protocols for this. And there are some other examples which I'll talk through as we go, but you can see it's a huge amount, and it's a huge concern globally as well. So this one example of a solution covers 4 main areas. So the dashboard, which gives them an overview of the current financial year, the key metrics and lead-in antibiotics that were ordered. The ABX utilization tab gives what top 15 antibiotics have been prescribed or across the health system, who order them, so you can start trending to see if there's any particular clinicians that there's a pattern in that process. The reason for ordering it, so you can look at the clinical reason to see if there's justification for that, and any other related trends. The year-on-year comparison allows comparison over the last 3 years of the top 5 antibiotics, which clinicians order them, and the reasons, again, to see if there's any trends and things that we can do to potentially limit that or prevent that from happening again, with some education or enablement programs. And then just order by patient demographics, just to understand whether it's a particular type of patient or a cohort that often leads to the prescription of antibiotics. To better understand, maybe there's some more research or investigations that we can do to develop a better model of care to treat these patients, rather than just relying on antibiotics, which may have a more detrimental impact down the line. So this dashboard Again, similar to all other Qlik applications, allows the filter panel on the left-hand side, so you can select the different facilities, different outpatient, different encounter type, what clinical unit, department, any provider, etc., and it all filters down. So this is just an overview for the entire facility. So 317,000 encounters, 62,000 antibiotics have been ordered, and the rate of antibiotics per 1,000 patients is 11.79, which is quite significant. And it talks you through the different antibiotics rates over the course of the year, so you can see whether or not there's any trends or any peak periods or whatever it may be. The leading ordering ordering departments to again filter down and see if there's a correlation there. And this word cloud here is just an easy way to understand what type or which antibiotic is coming up more often than not as being prescribed, and that it might give you some new insights around that practice as well. The utilization, as I've mentioned, top 5 antibiotics ordered, by whom, why, and related trends. So you can hear the looks at the primary or the indication around why they were ordered. So he's sepsis, unspecified organism. That's like probably warranted that, because sepsis is a major infection that needs antibiotics, but there might be some other things in here, urinary tract infection or something here that doesn't necessarily need antibiotics. So it's a way to be able to track and understand and ask the question whether or not the antibiotics should have been delivered or prescribed and dispensed as well. So this again gives you some trends and some information to further unpick and dive deeper into the detail. The year-over-year comparison, as you said, allows you to compare the different ordering patterns across different antibiotics. You can see here the count of antibiotics orders for these 5 different antibiotics here. You can see the quite remarkable increase over the last 2 years compared to the third, the years over the third. So you can see how you might want to prevent those huge volumes of orders across these specific antibiotics. If we're here this was presented in April last year, looking at how we might be able to put some mitigating policy changes or rules in place to prevent us from getting to those levels at this space. So anything there can help. Which departments order it the most? What the reasons for the antibiotics, the top 5 reasons, and the top 5 primary diagnoses. Again, just to give you an indication of where and why they're being ordered. And then the prescribing practices by patient age and demographics. So you can start looking to see whether there's any correlation to different age groups, male or female, different genders, to see who and why, and better understand your patient cohort. And that might impact some of the decisions that these clinicians are making around this space. So the key features of these applications is really just about shining a light on this, creating a level of transparency to be able to allow much more easier interaction, so clinicians and administrators get to critically ask the reasons and understand the reasons for ordering before they do. Rather than relying on gut feel and doing things how they've always been done, understanding the consequences of some of these decisions so they can make better decisions. So allowing that data filtering, that easy data filtering, to be able to ask many questions of the data, the responsiveness of Qlik, the trending, helping them understand whether the impact or decision around policy or procedure change is impacting on the bottom line. If they're making a change to certain treatment protocols or whatever it may be, or clinical pathways, is that having an impact on the actual number of antibiotics being prescribed, etc. So it's just a really key way of, again, creating a lot more awareness around some of the decisions around antibiotic prescriptions. So some other examples of AMS solutions, as I touched on before, the case was a US case and referencing the CDC. In the UK, they had a major issue as well around prescribing, and the BBC reported, some data around articles around overprescribing of antibiotics. But what they found is they had access to the data. They had all their GP provider data and all the appointment data from the GP. They had all the prescription data, but had no way of merging those two data sets together. This information was public. It was available on their data.gov website for download, so anyone could download. But they'd never been able to bring those two data sets together because their size, they were really huge, and the complexity in finding the linkage. And as you know, that's where Qlik comes to the fore, and that's our a big factor in why we're able to have so much success in healthcare, is that space. So we were able to develop an application for them that allowed them to combine, the $8 billion and $12 billion of annual spend between the GP providers and the pharmacy to give them a view across this. So we're able to build this application, and I can take you through a quick demo of it later, which talks about the total prescription cost, the total number of items purchased, the average cost per patient. And in this, importantly, this heat map allows you to see whether or not there are any problem areas, if you like, or sites in the UK that are prescribing antibiotics more than they should be. And then you can have some targeted campaigns around education, around whatever it may be, to get these clinicians to understand that they shouldn't just be ordering or developing prescriptions to antibiotics as a first course of action. This application, again, it was because it was free, or the data was public. We, Qlik, just built this ourselves more out of interest, and we saw some fantastic insights, and we shared this back with the BBC and then to the NHS in the UK, and they're currently using this to drive it. So that was just something that we were able to solve for them. And what it does as well, some other applications allow you to track different patient days of antibiotic use, the days of therapy, how many days of therapy have people been on antibiotics, and the length of therapy, how long people are generally prescribed antibiotics for. Because anything more than, longer course of short courses are generally okay, but longer courses of antibiotic use can have more bigger impacts on developing that resistance. So again, you can start looking at different years and correlations across different trends, but also the types of antibiotics as well that are more used. This is an example using Cefepime, different antibiotics. So looking at the different departments that are ordering them and tracking that to see, again, why that is. And you can start delving into the detail to understand why that is and why they're doing that. And then looking at the type of service that they're providing and seeing whether there's any correlation to that as well. The Food and Drug Administration in the US, they also have a public website which looks at adverse events reporting. So this is a public dashboard, and the links there, and I can share some further links with you guys as well. But they make all their anything around food and drug adverse events available to every public member. So you can go in and search and play around with different data. But I just did a search on these 5 groups of antibiotics, so amoxicillin, which is a common antibiotic here in Australia, but it looks at the different number of serious cases that they've had, how many people died from these adverse events to antibiotics, the total number of cases, and then looking at the different types of what the reaction group was, how many cases, and breaks it down by age group and the like. So if you're interested, you can always, I can give you the link and you can play around with that website as well. And this one is an example from here in Australia, in Queensland, and this is just their approach. And this was an older ClickView application that's been repurposed in ClickSense. But what they've done, it gives you a daily list. This is at one hospital, the Princess Alexandra Hospital in Brisbane. And it gives you it's almost like a census of the antibiotic patient list in the hospital. So at the moment, they know that they've got 45 patients on this one given day in hospital using antibiotics. The scheduled events, 149 different events associated with those patients. These are the number of administrative events. So, the medication orders online and other bits and pieces to track that. But this is an important one here that they are able to start using to track, which is IV, intravenous antibiotics that have been in situ, so in the patient's, arm or whatever it is, for over 72 hours. And there's been global research that shows that any patient with with IV in situ for over 72 hours is more at risk of a severe infection, potentially septicemia, and could lead to death. So what they did was start tracking this so then they could make sure that they had alerts to ensure patients don't exceed or go over the 72-hour mark. So they use this as a trigger to ensure that nursing staff and clinicians get around to the patients when they're creeping up on that 72 hours to change the IV line to make sure that there's no complications or adverse events. So it's just another way to track different types of use and monitoring antibiotic use across the facilities. This is an example. They call it Pharmalytics, so analytics for pharmacy. This is a statewide medication solution for New South Wales Health. And what it does, it just provides insights into the entire system. So we've got over 220 hospitals in New South Wales, all with their own pharmacy departments, etc. And this solution allows them to track medication usage. So it allows them to look at trends, whether the appropriate use of medications, the inappropriate use of medications, and allows them to set policies to be measured and created and then measured around the appropriate use of different types of medications, including antibiotics, but also things around codeine and other opioid and highly addictive drugs as well. But one of the other factors it does is it allows medication purchasing and stock levels, so more awareness around that, so you can monitor of costs and stock levels to ensure costs are minimized, and also to ensure that there's prompt access to medication for patients. So what this does is, we've got, high-end drugs like life-saving drug registers, and you can't have these same life-saving drugs at every facility. It's just not viable. It's too costly as well. So what they do is they identify certain locations across the state that can house these drugs, and then they also allow, excuse me, dogs barking in the background, but they also allow the staff to be able to look to see when they need a certain access to a drug, where it is, and they do some route analysis using Qlik geoanalytics to see how long it'll take for them to get access to it. So whether it's anti-venom, it could be a certain type of drug for cardiothoracic use or whatever it may be, but they use the analytics, the Pharmalytics solution to decide anything in and around pharmacy. This is just a benefits tracker, e-medication. So it allows, because everything's captured electronically now, they can start looking at, the antimicrobials with documentation of indication. So why they use reconcile medication. So making sure that no drugs are going missing from the pharmacies, any administration errors to, why if they've been prescribed the wrong way or dispensed the wrong way. So they track everything around compliance and safety practices and the rest as well. So a really clever system here to track that. So driving clinical change with analytics, some other examples here. And opioid, there's a global opioid crisis as well. People are getting hooked or addicted to these drugs, which can have detrimental effects to society and individuals and communities. And we've seen that everywhere, really. But a particular problem over in the US, where they've got a big problem in their communities, because they patients can doctor shop. They can go from one clinician or GP to another to get some access to drugs that would have been knocked back from another clinician, etc. So what they do is they actually combine their data from hospitals as well as fire, police, ambulance, and social workers to see where they can identify bad outbreaks immediately. So if the police service or a fire gets a phone call saying that someone's had an overdose in the street, then they can look to see where that drug came from, who their network is, to see how they might be able to prevent and interact and interject with those people before the stress, the cases go higher. So it's really about containing the spread to prevent death. They use that via Qlik Sense application. So they look at the triple-O calls, bringing that in and start looking at seeing where outbreaks are happening and how they can proactively engage with the citizens to prevent that. So this is they look at it from a whole state now. We did some work with the Department of Human Health and Human Services in the US. This is a heat map. Obviously, the states are coloured in the number of incidents. So the GP prescribing the opioid, sorry, and the different heat maps here, like the hurricane charts, are where there's caused death or more issues or concerns. So you automatically can see which states have a higher prevalence of opioid-related deaths or harmful events. And allows you then to track into individual, once you're in the facility, in the state, you can track down to local geography areas as well to see whether there's a particular problem. So here we're seeing that there's, just outside of Jefferson, we're seeing that there's a big influx of deaths or adverse events because of COVID, but you can see all these surrounding areas have higher prescribing patterns or claims from GPs. So you start to wonder whether or not these patients here are actually doctor shopping. They're moving from state to state or from city to city to get access to their drugs. So another part of this application allows you to do route analysis, so we can start targeting GPs from the location of death within 60 minutes, because people we found are generally willing to drive for 60 minutes to get their fix. And it's a way to then be able to track those and identify the culprits and engage them in some more tighter programs around the right prescription of opioids. Again, so this is the opioid deaths, the opioid claim count, the 2.8 million prescriptions in US alone. It's just phenomenal of opioids, how many deaths there were. You can start looking at again by different areas and the number of claims by different clinicians as well. So you actually scroll down to the different doctors themselves to see why they're presenting. And, this person here, because this again is all public data that's available online, but this doctor here, Nabil Coleman, has, prescribed 35,000 different units of opioid claims, which is quite significant. It's a large number, 22%, sorry, of his prescription opioid related. And you start to ask yourself whether that's right clinical practice or not. So obviously the opioids is a major issue, not only the prescriptions from the hospital, from the GPs, but also patient level prescription monitoring, because we want to decrease the number of prescriptions that are increasing that extend for over 7 days by 50%, because they realize that patients that are on these drugs for over a week, they're developing a dependence for them. So it's really about being able to track or I guess prevent duplicate prescription orders, but also track the morphine equivalent daily dose. So you might not be receiving morphine, but there might be a morphine equivalent drug that's being substituted that hasn't been tracked properly. And this application allows you to do that across Jefferson Health. So it allows you to see the different number of prescriptions, the top 10 orders with over that amount, the different types of specialties or the providers, so which departments. And then here, what they found was in their electronic medical record, 44% of the prescriptions did not have a duration. So they just had them, ongoing. So, patients may have received these drugs that, for a long time, because it just wasn't a field that was required. It wasn't a mandatory field to be placed. So that had a direct impact on patients receiving drugs that they didn't necessarily for longer periods. So it's just a way to track these, and again, like we said, put policy changes or changes to practices to improve that performance. Now, here in Australia, we've got a similar challenge, and what they found was that patients that present to an ED emergency department with low back pain, so non-specific low back pain, would often get prescribed an opioid to help with the pain relief. But what they found was that there was better ways to do that. So you could use better systems and medications, so ibuprofen and other anti-inflammatory drugs to help. And then rather than doing imaging or pathology or even admitting these patients, having different treatment protocols like physiotherapy and other stretching exercises to reduce that amount. So they had a problem. There was obviously all these patients, 50,000 patients a year that would come in, 34% scanned, 61% receive opioids, 70% administer, a lot of wastage in the system. So we had to figure out a way to improve that. So I'm going to skip over this video for now because I'm in interest of time, but it's a way that we use the data to explain and describe to the clinicians exactly what it is. Provide that real-time feedback loop so they understand the impact of their decisions around how they should change and what we're going to do. There's some other applications and data around one less prick, reducing inpatient pathology activity while improving quality of pathology orders. So it's not just an issue of cost, but it's really about patients, because if you're over-prescribing pathology, they're having more pricks, there's higher care costs, increased risk for complications and infections. And from a pathology service, they increase obviously their workload, slower turnaround times, and they have a reduced surge capacity. So a better understanding, rather than having just ordering all tests, because that's how you've always done them, is understanding specifically what tests are being ordered and what's actually being used and reviewed. Because they found that there was like 20 or 30% of the pathology reports weren't actually being read by the clinician. So it had no clinical impact or relevance to their care. So why were they ordered in the first place? So it's just about a better understanding these ways, initiatives around ordering practices and education to the clinicians around the impact of their decisions. And outside of this, outside of pathology, you can do similar initiatives have been developed for imaging to better understand, rather than a patient being undertaking 2 X-rays and then maybe a CT scan and then an MRI because they're still not happy with the results. Instead of wasting the resources on the others, maybe you should just order the MRI to start or the CT scan to start, so you can get a better indication and not have to one, pay for the service, impact the service, but also compromise the patient as well. This is just a revolutionary improvement on multiple sclerosis treatment. This is a German use case, so a bit closer to you guys in Europe. But 2.8 million people with multiple sclerosis around the world, so debilitating disease. We partnered with a group called Neurotranslator. So this is a bunch of clinicians who brought together to create their own network of neurology and psychiatry patients to treat patients in Germany with multiple sclerosis, dementia, epilepsy, etc. So they wanted to have a more targeted, focused group around what they can do for these patient cohort. And what they found is, like we said before, their previous system was really about trial and error. They would try a treatment protocol in a patient with multiple sclerosis. If it didn't work, after 6 months, I'll try something else. If that didn't work, I'll try it again, so it was almost like a trial and error until they got their treatment program right that fit for that patient. So what they do is they use facts and evidence from past patients with similar characteristics to the current patient to become more individualized and targeted with their treatment program. So they use all their data from the past, historical data analytics and independence. They got validation from doctors. They got the current information from the current cohort of patients and doctors on the right-hand side, and then merge that all together to be able to get this solution, which allows for clinicians to use a touchpad or an iPad or something similar to be able to enter some key data around the current patient, and it goes through in the back end of their algorithm, does some predictive modeling based on the characteristics and the demographics that the doctor entered about the patient, and does a prediction for them. So you're a bit more targeted in terms of what treatment protocol or program is going to work for that particular patient. At an aggregated level, you can look at data completeness for who's in your service, how many need to come in, who's not come in, who hasn't visited in 12 months ago. So you can look at rebooking, etc. And then you can do some integration with their electronic medical record, if you like. And then at a patient level, you can look at things, who's been within the last 3 months, what new therapy have they received, have they relapsed, any activities, and all these other bits and pieces. So you can start looking at different warnings with color schemes to leverage the doctor's decisions. Again, the computer or the algorithm is not telling you what to do, it's providing the doctor with enough information that they're able to make the best decisions around that. So the senior executive of a global biotechnology company said that it is the most innovative and impactful digital healthcare solution in the neuroscience space that they have seen yet. So it's hugely impactful, and it's going to have great ramifications around the world. These are just some other examples. Again, I won't talk through because I've been speaking a lot. I think I'm almost out of time. Sorry, guys. But some around diabetes management as well. We know diabetes is a global chronic condition that affects every country. The one on the left-hand side, the Acting Zen IoT diabetes patient management system, that allows you to track and pull data from the blood glucose readings and systems to track, readings and treatment as they occur, sort of thing. So you might be able to increase or decrease the patient's insulin as they arrive, which is great. So it's more proactive and more in tuned diabetes management. And the one on the right-hand side is really about understanding your diabetic patients in your hospital, because they're not all treated in a endocrinology ward. They might be spread across cardiothoracic, in orthopedics, in geriatrics, in all different areas. So it's understanding, getting the doctors, the endocrinologists, the right information to be able to provide the right care, so that these patients don't extend their stay, they don't extend their length of stay in the hospital, but they get the right treatment, collaboratively with the other treatment team, specialist team, to ensure the patient comes out. Some helpful resources. These are just some customer videos that might be of interest to you. Some customer snapshot stories or upshot stories. These are the voice of the customer. So they're independent of Qlik. This is just our customers talking about some of the success that they've had using analytics and Qlik as a back end. And this is the healthcare customer success solution posters on our Qlik gallery. There's some amazing stories and solutions on here to inspire you guys. So it's a public website. You can go to the gallery, search for healthcare, and get inspired. There's over 70 healthcare posters online. So all with different screenshots, talks about the discoveries, the achievements, what data, etc. So it's a great way to get inspired and get ideas for some of your own development. So that's it from me. I just want to say data is only as valuable as your ability to act on it. And I think Qlik helps you act on it.